When your doctor asks for an X-ray to be taken, they want us to help get a diagnosis for your child. At Pureform, our goal is to get the best images possible for our radiologist to make that diagnosis while making your child's experience the best it can be as well. Our technologists are all experienced with children's imaging and know how to get the images we need as easily as possible. Because we're using radiation, we always want to limit the number of images and lower the exposure to the lowest dose possible. We strictly adhere to the ALERA principle, as low as reasonably achievable. But we also know that we can't image children the same way we do adults. Children come into the X-ray room scared and want reassurance. We normally have one parent or caregiver helping, but if you'd rather not be in the room with them, we respect that. We always start by explaining what we're going to do. We want children to know that X-rays aren't going to hurt. It's much like getting a picture taken. You can't move or it will be blurry, and the doctor can't get a proper diagnosis. Sometimes you have to be placed in a position that's not that comfortable, and we always try our best to do the images as quickly as we can.
At Pureform Radiology, we as parents believe that children deserve a children's specialist. So some of the types of examinations we do here require the use of specific positioning tools for kids so that we can put them in exactly the right position to get exactly the right type of X-ray and then to be able to provide the correct diagnosis.
Babies and toddlers can't stay in the position we need them to on their own, so they need to be held in place. Often it's better to use a positioning device that holds the baby in the correct position, very still, and limits the radiation to everyone else as well. We use the same positioning aids they use at Children's Hospital. They may look scary to a parent at first glance, but please know that we can get the best images with them and avoid repeated images for motion. We place the child safely into the holders where they're held in place securely. Sometimes the baby will cry because they're scared, and of course it's not as warm and cuddly as your arms. When we do chest X-rays, we ask an adult to take in a big breath, but of course we can't ask a baby to do that. So when they're crying, they are actually taking in that big breath, and we can get the same great images of the chest and lungs.
Here at Pureform, we'd love for parents to understand that sometimes kids are kids and they can cry and they can feel a little uncomfortable. We do our very best to make patients feel really, really comfortable, but having a really positive outlook, having a feeling that you really want to be there with your child and that the staff here is hugely supportive of that type of positive energy is going to be really important to assuring that your child has the best possible experience they can have. Sometimes they get put in a little bit of an uncomfortable position, whether it might be in a positioning device such as what we call the pigostat. Sometimes that's necessary and kids just naturally get upset from being sort of stuck in a specific position. I would just say to you that we're not hurting your child and your child won't feel any pain whatsoever. What they will feel is a little uncomfortable, but knowing full well that we'll be able to provide the best possible diagnosis and the best possible treatment options and recommendations for your kids.
We do all the images we need as quickly as possible, and then as soon as we know the images are complete, we remove the child from the holder and return them to your arms. For some X-rays, we need your child laying down. Then we put them onto a holder and secure them safely with soft Velcro straps.
When you bring your child to the ultrasound room for their ultrasound, we'll bring them in. We'll usually have them change into a gown so that we don't get their clothes jelly. We lay them down on the bed, we explain the exam. Usually I'll let them touch the gel, I'll let them touch the cameras and feel more comfortable. The parent can sit on the bed with the child if they'd like, and then we usually turn on some Netflix so the child can relax and just watch. During your ultrasound exam, you can expect to have some warm jelly placed on their belly. There'll be an ultrasound camera placed on their belly. Not very much pressure is applied, but we do apply some pressure. A bunch of pictures will be taken according to our protocol, and it can take 15 minutes to an hour long. When the parent brings their child to the ultrasound clinic for an ultrasound, I would like them to have a positive attitude and a calm attitude. And use positive language when talking to their child about the exam. Instead of saying like, oh, this isn't going to be scary, or oh, it won't hurt, maybe say, oh, isn't this going to be fun? We're going to take a picture, or we're going to watch TV while we take some pictures. You can bring things like comfort items, like a stuffed animal or a blanket that they love. It's also really good to bring distractions, like maybe a cell phone with some movies or music on it, and some toys for them to play with. I think having a calm and positive attitude really helps the child feed off of that and have a good experience here.